So we're going to transition into a panel discussion here. We're going to give you also an opportunity to talk to the panelists as well. And I'm going to introduce you to them in just a second. But at the same time, in your packets, there are bios for everyone that's speaking, and I'm not going to belabor that with you. But I will do, just kind of capture who's on the dais here. And I want to thank them for their attendance here today. And the idea behind asking these four gentlemen to be here today was to give their perspective at a state view kind of look, and as a part of saying what is the as-is experience that we're having in California at this point in time. So we have David Maxwell Jolly here to my immediate left, and he is the Undersecretary for the Health and Human Services Department, right? Agency, okay. And David has a distinguished career. Many people know all of the good work that David's done. It's been in both the mental health area and Medi-Cal, and he's known as kind of the guy who can get things done. And so he's somebody that is looked to across the state for solutions. Don Will is the next person. Don works for the Center for the Families and Children in the Courts, and has worked for the AOC for a number of years now. Don, a lot of his work at the Child Welfare Council and the Data Subcommittee, and some of the opinions that have been written. And he's here to represent the AOC. We have Will Lightbourne, and there's nobody, I don't think, that has as much experience in child welfare as Mr. Lightbourne. It's 3 directorships in the state of California, and was kind enough to take on the job at the state level just beginning in April. And we thank you for that. Because your perspective is much appreciated. And then Barry Zimmerman, who spoke earlier, is the director of the Human Services Agency for Ventura County. And when Frank Mecca decided to go to Hawaii instead of coming here, I mean, come on, he offered that Barry would be a good representative of child welfare directors in the state of California. So we're going to start with the first question. And what we've asked for people to do is to give their perspective and respond, and then we'll just kind of go where whoever wants to start first. We'll just leave it like that, and I'll kind of monitor the questions. But so what I'd like each of the panelists to answer first is if they could provide a brief overview of 1 or 2 of the most promising cross-systems information sharing initiatives that their agency is involved in presently. So, you want to start, David? And yes, we need to do the mics.
Do we need to make them handheld?
Yeah.
Okay. Thank you. In case you, am I on? Yeah. Great. The intention may have been that these armchairs would make us feel more comfortable, but I don't know whether that actually works.
You're a target now, right?
Right. The other thing is that the introduction imposes such a crisis in rising expectations that I don't know what I'm going to say. However, I'd like to talk about one of the key things that we are in the midst of developing and nurturing through the Health and Human Services Agency. We have in the room Lynette Scott, who is our acting Deputy Secretary for Health Information Exchange, Health Information Technology. And through the generosity of the HITECH Act and that was in the Recovery Act, there's been considerable amount of funding and support and focus on the idea of trying to build an infrastructure to improve the capability of exchanging health information, getting health information into automatic electronic records, and then being able to exchange that information more freely throughout the healthcare delivery system, provider system, and to other entities who would have a need and responsibility around that particular health information. There's been lot of infrastructure put in place over the last few years to help advance this idea. One of the fundamental things that's just recently been launched in the Department of Healthcare Services are substantial grants to healthcare providers to encourage their development of electronic medical records, to be able to get health data actually recorded in an electronic form, so that it would be available not for their particular uses, but also be available for broader uses as well. That includes hospitals and primary care and physicians primarily throughout the state. In support of that, there's a set of institutions that have been created. They're kind of like Farm Bureau. What do you call them? They're regional cooperative efforts to be able to provide advice and information and help for providers in their effort to provide electronic medical records. That system, if that develops, there's the expectation that those electronic medical records will be able to expand the ability and the use of electronic data to support the delivery of health care. And in fact, one of the requirements, if you're going to take on one of these grants, is to be able to demonstrate that you will be using the data and using the record in a meaningful way. And that it's called meaningful use, and it's got a lot of definitional stuff around it. But some of the uses you could imagine would be to exchange data with laboratories to get lab data online, exchange data with pharmacists to get prescriptions registered directly to the pharmacy, and to get feedback from the pharmacy about whether or not the person actually filled the prescription, which is a kind of a gap in information that physicians often have right now. To increase communication between the physician and the hospital about what's going on with the patient. So this is an infrastructure that will be at the ground level, and what it does is it raises a secondary level of questions, or what are the rules of the game, and what is the infrastructure that's going to be there that's going to be linking all these records and putting them all together. And so in addition to developing the electronic medical records, we've been doing a lot of work on electronic health exchange, where we're trying to come up with the rules of the road, trying to figure out the right kind of configuration and infrastructure for how we're going to then use this recorded data and share it among all the people that need it. There are a lot of tough questions about health information exchange. The questions about what's confidentiality. Do we have a common conduit that we all share? And if we do, how do we support that economically in the long run? What's the business proposition around that? In California, we've heard a little bit about some of the local health infrastructure here today, about where they're local in San Diego, the Beacon Project, where locally providers are getting together and setting up health information exchange structures to be able to share information. So what we've been doing at the agency is, with grants from the federal government, is trying to get all the stakeholders together to provide an infrastructure. We've set up a nonprofit organization, which is our key planning entity, to think about how we convene people and build in an exchange infrastructure. And we've been working in healthcare services to roll out the grants that are going to be producing, high tech, to roll out the grants that are going to be encouraging physicians and hospitals to get more health data, electronic medical records. So what does it all have to do with foster care? Well, I think that this is going to be a key source of data that has the potential for us to be able to provide a much richer picture of what is happening in terms of the treatment history, condition status, and et cetera, for our children in foster care. The data that would be available through these sources could be key data that would help manage the health of children who are in the foster care system. And I think that one of the opportunities that we need to explore, and it has the same list of, of punch points, right, about confidentiality, infrastructure, who pays for the sharing, who gets access to what, and who can share it beyond the initial point of access. All of those questions need to be sorted through in the foster care context, just the way they need to be sorted through for each of you individually in a larger health context. So a lot of important work to do. It's like building the Bay Bridge. We're building it from both sides at the same time, and we have every expectation that it'll meet in the middle. But that takes a lot of care and feeding along the way to make sure that the record business and the exchange business and the confidentiality rules and the other institutions who have a stake in this are sitting at the table, participating in that.
Great. Well, we'll take a couple of questions for you, though, David, really quickly, and just in response to your opening remarks. Questions?
How do you foresee utilizing, you talked about regional extension centers, utilizing the support that they provide for building an infrastructure for information exchange? How would you foresee leveraging those for integration and exchange across health and human services?
I think the regional extension centers in their current configuration are fairly short-lived in terms of the supporting the development and procurement and initial use and a little bit of maintenance of local health records. And we have been, I think the work that we're doing with the Cali Connect and others, in collaboration with others, is to try to develop what is our strategy. I think California, we have a lot of different opportunities. I think some states, they're not so large, probably have an opportunity to set up a single health exchange within the state. In California, I think we have homegrown exchanges that are going on throughout the state, or that are showing that they can actually do it. They set up the rules. They know how to. In the long run, we're going to have to figure out how those exchanges can be financed. But I think that we'd be looking to the regional exchange, support centers to be able to make sure that there's engagement at the provider level with those exchange activities that are happening. I mean, electronic medical records by themselves are useful, but their greatest use, I think, the larger use, the community use that we hope it will achieve, will be in that larger engagement. And I think we'll be encouraging the centers to be able to conceive of that and figure out ways to support that.
Okay. One additional question over there.
Following up on the question, at the local level, we see the governance of the groups coming together since, in truth, HIE benefits the safety net population, whether it's foster youth, disabled, indigent adults. The ability for social services and other agencies to leverage the HIEs don't seem to be moving forward in the governance meetings. And so do you have thoughts on how you might really, truly encourage that these are the citizens that they would receive benefits and incentives for?
What do you see as the constraints that are hindering that advancement?
Did you
I'll give you an example. One county department shared and asked that we might meet with someone in public health leading an effort with their local community hospitals and clinics when the hospitals stated that the incentive funding for the infrastructure really was theirs, and they really didn't see a need to continue the governance meetings with the social and child welfare agencies.
Yeah, well, I think for my money, the advancement and the real maturity of health information exchange is going to come out of the business proposition. I mean, what you've got to do is you have to have a shared business interest. The entities, the health provider side of it have got to see that there is advantage to them in being hooked into a larger exchange community, and in the same way that social services agencies or support agencies that providing services to in the community need to see the advantage of participating in health information exchange because that information is useful and helpful to them. I think at the current state of affairs where we are right now, we could hook up and exchange information right now, and it really wouldn't be of much value necessarily because you can get a lot of texture into the daily treatment history of a foster care kid, but that's not going to answer the pressing questions that you need to manage a case on a day-to-day basis. And so I think part of the planning process here has to be making sure that we not only can exchange the information, but we can format it and distill it into the kind of information that's most relevant to the exchange partner. At the front edge, exchange with a lab to the doctor, obvious business benefit there. It's harder work to come up with the kind of data you get out of a medical record that's going to be useful to the social worker who's trying to figure out how to serve a kid in foster care. So there's work to be done, and I think as people recognize the value, I think they'll come to the table and want to participate and do it.
Okay, I'm going to ask Barry if you would going to go bookend there, but you were kind of waiting that it was going to go down the line, right, Barry?
I was waiting for the So going over some of the initiatives that the information sharing, I think on a practitioner, I'll speak kind of to the practitioner level here from the county's perspectives, because I don't think it's much different than what we're doing with our counties, because I interact with others and hear what they're going with. I think one of the big things, we have a lot of initiatives at the state level that we're excited for, that this will help facilitate greater capacity within the child welfare system. I mean, information is vital within the system, and I think if you focus in on that, that is a key. How do we get information, the right information, to the right place, to the right person at the right time? And I think that's the objective and goal that we're trying to achieve. And so there's a myriad of interactions that occur within the child welfare system, from the beginning of a case through the court system and on the termination of the case. So the spectrum is huge as far as managing information. So there's initiatives out there that I'm aware of okay, just getting information to the court system timely. And doing it in a fashion that is consistent and that is common amongst all the parties that deal with the court system. And so, for example, we've initiated taking from paper to electronic format and having a distribution system that everyone has equal access to. That's a huge step. And a very dynamic step in the sense of now you're taking from paper to electronic. And I think that's one project that is going on in multiple arenas at this point in time. And I don't know how to stress that more in that cultural change within the practitioner level, taking it from one cultural norm of saying that we've dealt in this arena of case management, paper, dissemination of information in this fashion, and now saying you're going to do it differently and transform that for the benefit of not only yourself but of others. As simple as we have it is electronic referrals to law enforcement is a big issue. And you're dealing with multiple jurisdictions, and how do you come up with a consistent practice that everyone can accept? And that was a big issue for us in our county. And we're not huge, but, we have 7 or 8 law enforcement jurisdictions. How do you do that? Who's the point? How do you get cross-referrals and information disseminated back and forth in the most timely fashion? Well, electronic means is the means to do it. But when you go into law enforcement and they say, well, our fax machine, and when the papers get this high, then we have someone come over and pick up the papers and walk it to this desk here. So it's a whole cultural mindset that has to change along with the technology and the goals and the vision in order to make this happen. And I think that's a big effort that I wanted to kind of lay a foundation for, is that there's a cultural change in the dynamics of the operation that must occur and should occur. I think we've got the vision started and so forth, and now it's working down of changing that structure in order to allow multiple environments occur and initiatives to take place. So that was my input.
Some follow-up questions that maybe from the group. You were so erudite that no one has a question. So we'll move on to Will.
Thank you. First, I'd just like to thank Stewart Foundation and AOC as wonderful partners in sort of moving this agenda forward. From the CDSS perspective, obviously the biggest single thing that we wrestle with at this point is the fact that our CWS CMS basic core system, which has very limited interoperability. It primarily it can exchange data only with sort of meds, TANF system, and child support. I mean, it's that limited. Was in a sort of a design phase for replacement, or CWS Web was sort of the acronym, and for which would have had an operability relationship to something like 13 separate databases. For budget reasons, earlier this year, we characterize it as permanently paused. The system is not going to get built as it was being conceived at that point. Since then, what we've been working on intensively within the department and in our partnership particularly with our county partners, is doing several things. First, documenting the gap between the current system and actual practice needs, and they are enormous. For those who were active in the field when CWS CMS was deployed and remembered sort of the pilots and the rollouts in the 90s, it was an old system when it started. It's a much older system now. It does not offer line workers the kind of access, the kind of relational databases that are really needed to do the work in the modern period. So what we're doing is sort of documenting the extent of the gap between current system and practice, and in partnership with Office of Systems Integration, which does our detailed system design build work, looking at all alternatives, and I really mean all. I mean, whether it's we rebuild the current system and replatform it, whether we build from the ground up a new system, whether we go out into software service systems, really trying to examine what are the things that could not just meet the needs, but really do a good job of attaching practice to the related systems, including courts, behavioral health, income employment service related information, and then service providers in the network that our counties rely on, and behavioral health very, very, very powerfully. And also look at how to do this in as economical a method as possible. We are scheduled to do a report to the legislature in January on both the gaps and the possibilities, and so hopefully we expect we'll sort of have a strategy that can move forward from there. One thing I would, although I'm firmly committed to trying to help make that happen, I would just sort of note the one piece where I always feel a slight skeptic in information sharing conversations, which is this. The sharing of the information by itself isn't going to meet people's needs. And information sharing isn't a replacement for consistent case management or practice, and it's not a replacement for actually having services available. David used the sort of analogy and development of the health data systems, of sort of building from both ends and being confident that the bridge will meet in the middle. I think so, yes, but I always worry that data by itself is not going to provide the services that are actually needed. I think it was Ventura who sort of famously said, the tragedy isn't in what we don't know, it's in what we don't know about what we do know. And the systems that we have to tie together have to, I think, assure not just the children, although that's the focus of our conversation thus far today, but their families, because that's the context in which we meet them, the context in which we're trying to restore them, and hopefully the context in which we even prevent their leaving their homes and coming into care and being looked after, that the services and the supports that they actually need are present and in place. The other piece, which I know is in progress, in fact, it was featured this morning, and I just want to pay my respects to the 6 counties, my colleagues whose efforts were featured, but particularly the Sacramento Foster Focus, which is doing such an extraordinary job of sharing information for school systems and foster kids, is being used now by 22 counties. I believe LA is building a relationship to it, and certainly CDSS is working with the Department of Education to try to see how we can facilitate, make possible the spread of similar sorts of systems statewide, realizing different counties, different education systems will use different platforms, but the importance of that information speaks for itself. Let me just stop there, see if there are any questions.
Any questions from the floor?
Good.
Okay. When's that report going to come out again?
The report is due in January 2012.
Okay, great. Okay, Don.
One of the people responsible for dragging you out of, one of the people responsible for, dragging you out of your homes into Sacramento today and tomorrow, and I think that is one of the major initiatives that we at the AOC and the Juvenile Dependency Court feel that we can do, not drag you out of bed, but bring us all together. Following, I think, the model of the Blue Ribbon Commission, we were very successful under the leadership of the Chief Justice, Justice Huffman, Justice Moreno, and others to bring all these folks together, all of you, many others, that sometimes for the first time to start talking about this. 10 years ago, I would say, I started going to meetings about this subject in child welfare, in health, Medicare, court improvement. And there was a general feeling that it's all kind of hopeless. The laws are too complicated, and the systems are too big, and we don't return each other's phone calls, and it's fragmented anyway. You can't tell if it's county or state, etc. So a lot of people have worked really hard to bring down those barriers. Many of you are here today. So that's one initiative I think we should all take seriously, is keeping that going and really bringing something out of today. When we began with the Blue Ribbon Commission and started thinking, how can we give guidance or untangle some of the intricacies of FERPA and HIPAA and the Welfare and Institutions Code and other things that we often inhibit data sharing, often for really good reasons, and often for reasons of kind of personal mythology. Larry Bolton, the counsel at DSS at the time and a Blue Ribbon Commissioner, said it would really be good if the courts took the lead on this, because none of our state agencies could really sit down and say, I'm going to pronounce on how to interpret FERPA or how to interpret HIPAA. So we went into that. Chris Wu will tell you much more about it tomorrow. But I think we really were able to pull a bunch of people together and come to some agreement with county council, with agency staff, with the National Center for Youth Law, our wonderful consultant Rebecca Gudeman, who's also here, to really come up with some clear guidance to, well, there's probably more you can do than maybe you thought you could in terms of information sharing, and then there are certainly some things that it's true. We need to respect confidentiality. We need to respect privacy. So that's one initiative we keep working on that I'm very proud of. I think the other initiative would go to what Will just said. When we started the Blue Ribbon Commission, we thought, well, talking about information sharing, this is pretty cool. The court is building a case management system. The DSS is building a case management system, and we're all working together so we can share data. So, 4 or 5 years, it's all done. And, of course, that hasn't happened. And both systems are on hold or going slower than we thought they would. So what can we do? And I think for me that was the point of the county visits that Richard and Barry and many others just presented. Well, what's going on now? What can we do that we could replicate and do in another place? If Orange Court, for instance, is finding out that you can save money by allowing social workers some access to your court information system. Well, what a concept. That would probably bring many other courts on board to do the same thing. If we are finding ways to package education data in a county, then what can the judge see? Independent of, building multi-million-dollar case management systems to share that information, what can we do in the meantime? How can we're kind of like sailing on the boat, and it's kind of leaky, and it looks like we're not going to get a new boat anytime soon. So, we got to fix up this boat, and not just patch it, but make it a better boat while we're sailing. That's enough. I'm not good at metaphors. So okay. Those are our initiatives.
Some follow-up questions?
Stephanie.
Hi, I'm Stephanie Gluckman from the Children's Partnership, and I just want to follow up on what Dawn's saying, with the SACWIS redesign held and the court case management held. The question is, how can we move forward with the sharing of information across agencies? Well, I think it's really important to look to what David was talking about, because right now there's such movement at the federal level with healthcare reform, movement towards health homes, movement towards health information exchange and electronic health records, meaningful use of electronic health records. There's money through HITECH and ARA for that. And if you exchange some of the social service information with the healthcare information, it can actually improve meaningful use for the physician providers. So there's potentially a way to get funding and momentum to satisfy what we're looking for through the Fostering Care and Connections Act, through, like I said, ACA and health homes, and just through the sharing of information. So I think really right now where the movement is and where we should focus a lot of our attention is through healthcare and how we can leverage that, leverage the federal funding, the federal appetite that they have right now for the sharing of information, and that in the pilot in Ventura County, Foster Healthcare Link, we are actually working with the state to leverage the federal high-tech money, the 90-10 match, to do exactly that and improve meaningful use for the electronic healthcare records. So,
David, would you want to respond to that?
Yeah, actually, I would like to. One of the ways that the federal government is trying to focus the efforts on high tech into more sort of less theoretical infrastructure, blah 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 stuff, but actual useful stuff for some programs is they call it setting a breakthrough goal, and the idea here is to fix on some sort of area where an improvement seems like it'd be really worth working on that includes this information exchange as a key element of it. We've selected a couple of breakthrough goals this year, and one of them is getting better integration of personal care records in long-term care, which is another one of our integration needs, but the other area is in foster care. What we would like to do would be able to establish the a structure for a personal care health record for a foster care kid, and at the same time have that link, be able to link with the information that be generated from the perhaps multiple providers that might have been coming in contact with that child. So this would be a unified record that would draw off of the data from their individual provider records that they experience throughout the state. And it would be a place where you could get good, up-to-date information about immunizations, about allergies, about health conditions, about current treatment plans, et cetera, et cetera. And so this is one of the areas where we are trying to use the focus of the health information exchange to concretize, the goal and to make a very specific advancement in an area where we, for many years, have been struggling. I mean, it was 10 years or 15 years ago we had the passport idea floating around quite actively, and so I think this is an opportunity to, have that instrument available and have it be able to be populated by the data that's available through the electronic records that we have around the state.
Thank you. One last, Jane. Just wait.
Thank you. I'm Jane Henderson with the Center for the Future of Teaching and Learning at West Ed. And along with my colleague Trish Kennedy from the Sacramento County Office of Education are among the relatively few people here from the education side looking at information sharing systems. And with the assistance of the Stewart Foundation, we've been working with many of you to promote state and local level discussions about the two-way information sharing between particularly education and child welfare. And I just want to emphasize that really does need to be two-way. It's more than just populating the child welfare records with school records. Educators need to know something about the foster care status of children in their schools who are in the foster care system. It is a largely invisible population. And we have worked with teachers across the state to talk about particular education strategies that they might be familiar with, know about to enhance education outcomes for students in foster care. But the first thing is that they really do need to know who these kids are. And so thinking about making sure that the flow of information goes both ways with the schools, I think, is very important.
So I'm going to ask the panelists, we're coming up on the lunch hour, and I know that you're all anticipating that, but I'm going to ask the three remaining panelists. David talked about a breakthrough goal. So coming out of the conference, if you could just say, what would you might want to see as a breakthrough goal that you might suggest for the rest of the remaining day and a half here? So who wants to start? Okay. I'll select somebody. You got the microphone, Will.
I think Jane just in some respects went to exactly the place, which is the sooner we can not perfect, but move further forward on the sharing of information, and she was exactly right. It's not just one way between child welfare and education. It's one of the most important things and one of the clearly most frustrating things at a practice level for both schools and for local child welfare agencies is not having that information going across the systems. So that, for me, would certainly be the short-term breakthrough. As Stephanie mentioned and David affirmed, obviously there's enormous potential downstream with the development of health exchanges and the extent to which the tri-agency approval of new allocation methodologies that allow human service systems to be approved in part with health systems does offer, I think, a vehicle. But, I mean, realistically, we're talking about probably 2015-16 before that becomes practical. So those would be the primary things I'd look to now.
Okay. Barry?
Yeah, I would like to echo a little bit. I think the breakthrough goal would be to identify the information that is vital for the outcome and success of families and children, and focus in on the attainment or goals of outcomes we want to achieve, and not so much the goal of simplifying the sharing of information. And I think that's our intent, but oftentimes we lose that statement of what do we want to actually achieve or have be the outcome associated with sharing school information with the child welfare system. That we would like to see an attainment rate of X or Y or a trend that gets us to that greater outcome that we would like to achieve.
Okay. Don?
I think in the next few years, I think if we can demonstrate some of the things that Sonori from Orange Court was talking about, if we can demonstrate that sharing data among the court, among the schools, and child welfare can result in better court orders, it can result in a reduction in continuances, it can result in the massive misuse of social worker time, entering and re-entering the same data into different databases. If the social worker knowing when the hearing is going to happen results in a great savings to the departments, we know it does, but we have to demonstrate it. I think if we can demonstrate those things, we can demonstrate that we really need to have these systems that share information.
Okay. Any comments from the group? Any questions for the panelists at this point in time? Okay, we're going to leave one last question for everyone to respond to. Is that we've heard this theme already around confidentiality. If you can really quickly reprise what you think, how we might be able to overcome confidentiality concerns within the system. You start, Don. I know it's a broad question. Go for it.
Yeah, give up lunch.
Yeah.
And we have a whole panel on it tomorrow.
Yeah, right. No, we're going to have a whole panel on it tomorrow, but I'm giving you a shot.
We thought, Chris Wu and Justice Moreno and me and many others, that if we put all the county council in a room together with, support and goodwill and participation of policymakers, we would kind of walk out with a blueprint to solving our problems, protecting privacy and confidentiality of children and parents, but being able to share this information. And that didn't happen. It's really, really complicated, and there's no one answer. And I was at the same meeting that Assemblyman Bell referenced where, it was with the Child Welfare Council, where a number of foster youth came forward and said, we don't want you to share our information. We think that's, very strange that you're trying to develop this network that will, so everyone can see our private information. So it's complicated, and we don't want to get it wrong, but I think that we heard from the counties, many counties today, I think there's basic solutions already happening. We have to find the good ones and foster them, bring them forward and improve them. It's going to take a while, but I think it's doable.
Great. David?
I've had the opportunity to participate over the last couple of years in the data committee of the Child Welfare Council, and I think it was one of the committees in Child Welfare Council that I think has really taken some steps forward. We've had good active participation from the courts. We've done a lay of the land. We've focused on the county council question, but I guess I want us to tread carefully here, because I think that there are we all feel very strongly about confidentiality. And when you think about your own personal information and who you want to look at that and who you don't want to look at that, we are I think, a country that does value the confidentiality and confidentiality protections for our own personal information. For us, particularly in government, to maintain the confidence of the population around the information sharing that we have to do